I've been at WashU since 1986, actually. I came here as an undergraduate and then did my MD and PhD at WashU. And sort of at every step along the way, I thought I was going to go back home, which is the East Coast. But at every point, there was a really good reason to stay. WashU is a great institution, and the education is phenomenal. And when I had an opportunity to stay on and do my ophthalmology residency, I decided that that was a good choice for me. And had great education, never regretted a minute of it. And then when Dr. Cass offered me a job to stay on as faculty, then the deal was sort of sealed, and so my family's given up and they've moved to St. Louis. There are a lot of opportunities to really take what your passion is and run with it. One of the things that, as the residency program director, I focus a lot on from the faculty side is mentoring of residents and fellows as they come through the program. And mentoring is important at every step of your career. And even as young faculty, that was one of the things that was the most vital for my development, that I had excellent mentors here at Washington University, some of whom are still here and I rely on every day, like Larry Tyson over at St. Louis Children's Hospital, some who have moved on to, sort of bigger roles in their careers, like Russ Van Gelder, who was my residency program director when I was a resident, who's now the chairman at the University of Washington. But having him usher you through your career and be able to provide guidance was a critical element to my being successful at what I do. And the residency education element of it is in some ways the most rewarding because it amplifies. So Russ trained me, then I train a resident, and then that resident goes on, like Tony Pirro, who went on to be an assistant program director at Boston University, then he trains residents, and then they train, and so on and so on. And it amplifies over the years and really gives you a great sense of pleasure that you're doing something useful. A couple institutions come to mind right away. So Boston University, a number of their faculty trained at Washington University. University of California, Davis, people refer to as Washington University of the West, although Russ Van Gelder is trying to make University of Washington a tight contender for that title. And then St. Louis University, who's right here in town, a lot of our graduates have become faculty at SLU, and we are able to do joint lectures with them and joint teaching experiences, which is really wonderful to be able to draw on the strengths of both institutions to the benefit of our trainees. It's a little tricky because it's not a one-size-fits-all, and so there are a lot of people that come here that are excellent applicants that we'd love to see in our program, and it's just not a right fit. Fit is very important when you're talking about a 3-year residency. You can tolerate anything for a year, say for a fellowship, but 3 years is a long time, and the people who are in your residency class are going to become friends that you have for life, so you really want that fit element to be a big part of what it is you're looking for in a residency. And I would say to them that trust your gut. If you go to a place and you feel like, wow, I could really see myself fitting in there, that's probably true, and you need to consider that when you're weighing your options. And it might not be the place you thought. So you might have had a list of places you thought, based on their academic credentials and based on where they're located, are going to be the best place for you, and then you get there and you feel like a fish out of water because the personalities just don't click with you, or they're really spoon-feeding the residents and you're really more of a person that likes to spread your wings, or vice versa. You really need a little bit more hand-holding to get through the process. We try to strike a balance between both of those things and give residents opportunities for both. When you're struggling a little bit, we give you a little bit more of a hand, and when you're ready to be a little independent, we sort of push you out of the nest, and we try to strike the balance so that the training is comprehensive across the 3 years of residency, so that at the end, the product is a very confident and competent physician who's going to go out into the world and make us proud. Research is a huge element in our residency program, just as it is for the institution as a whole. We don't feel that medicine operates in a vacuum. Everything has to work together to drive the field forward. We do have a dedicated research block in our residency program in the first year of residency, and it's in the first year on purpose because it gives residents an opportunity to find their passion, to start to explore what they're interested in pursuing, and then they can set up a project that they can then follow for the 3 years of residency. And that has been a key element for our residents as they come through in being able to explore their passions. So some are going to do a basic science research project where they're in the lab playing with mice. Others are going to do a clinical research project where they're trying to answer a specific clinical question. Others are going to do outcomes research where they're really more interested in, if we use this intervention versus that intervention, the public as a whole will be better off because this one costs half as much as this one does, but the outcomes are equivalent. So there are all sorts of different things you can do. We don't mandate what kind of research the resident does, just that they find their interest and they pursue that. And that's one of the great things about our program, because everybody can find their niche and they can explore it further. The culture of collegiality is one of the most important elements about this institution specifically. So it's very funny, the NEI and the NIH have put forth these blueprint ideas for how research should be conducted in the 21st century, and it involves collaboration and cooperation between departments and between institutions. And when I read that statement when it first came out, and everyone thought it was such a novel idea, I kind of scratched my head, because that was my experience at Washington University since 1986. So I was an undergraduate working on the other campus in a lab on the medical campus, collaborating with a lab in a different department to get done what we needed to do. And so this is just the culture here. Everybody wants to answer the question. We want to provide better patient care. We want to drive the field of science forward. And to do that, you have to have open communication and collaboration with many, many different kinds of people. Particularly today, as things become more complex and our knowledge base is just not as broad as it once was because of the intricacy of the problems that we're asking, you have to have team approach to a lot of problems and questions, and that is very easy to do here. It's seamless. We have collaborations with the Department of Psychiatry, with the Department of Medicine, with the Department of Radiology, with departments on the other campus. I'm doing a collaborative project right now with someone in the Department of Psychology on the other campus, and it's really no big deal to just knock on the door, pick up a phone, or send an email and get somebody to join your team. If you've got an interesting question, they're usually very interested in helping out. You can't have a mismatch between the caliber of the questions and the science that you're trying to do and the clinical arena that you're trying to execute it in. There has to be a culture of excellence in both sides of that equation to be able to do the best work. And we're very, very fortunate that BJ and WashU all share that same commitment to excellence and commitment to driving fields forward and making progress and doing the best thing we can for our patients and for society. I'm the Residency Program Director. We have a wonderful residency program. We're very proud of what we do here and what we've accomplished, but we have excellent fellowship programs that encompass all of the various subspecialties, including ocular oncology, uveitis, and ocular pathology, which is not the case in all institutions, and we welcome people to explore our fellowship opportunities in addition to our residency program.